The quality of care, health care provided by the secondary health institutions has deteriorated, and women accompany their patients, the patients in their family, in the hospitals, and they take care of them in the hospitals. This is a Greek specificity. Really, when the crisis arrived, and we had this deterioration in the healthcare system, the national health system, women were overburdened because of the care input they had to make for their beloved people and their relatives. So indeed, we had a great problem, an increase in the care work undertaken by women. We also had a problem with in the public sector and in municipalities because of the in nurseries, for example, who dismissed their personnel on contracts because they couldn't renew the contracts. We had equally great budgetary cuts because of lack of resources in municipalities. So we had a deterioration in the provision of care, of formal care, and also many medium class families who were able to send their young children to private nurseries were no longer able to provide for this extra money. So they to keep the children home, trying to take care of them by themselves, or ask their parents to take care of their young children. So the whole household economy was overburdened with more care tasks. But very soon there has been a program of free access to childcare undertaken by the governments, our different governments. A program funded by the European Social Fund started in Greece, offering access of children to nurseries, to private or public nurseries and creche, in order to cater for the needs of families, in order to combat poverty and the care crisis. Because, as I said before, there were a number of families that had lost their incomes. We had many jobless households with no income at all. So the state stepped in order to help these families to cater for their young children, because in order for the members of the family who could find jobs or who could keep the jobs, be able to get on with employment. So in order to prevent the care crisis, the state started this program, and gradually it covered more and more families. And now about 70% of the families are beneficiaries of this program, which has extended to the middle classes as well, the impoverished middle classes. And the coverage of children by formal care has increased during the crisis. This is a Greek paradox. We have made good use of the European structural funds, and now we are in a position to have a good starting point in order to create a new care economy in Greece. Before the crisis, it was the families that took in charge a great part of the resources needed to fund the care, formal care, Now it's the state that has replaced, that has substituted for private expenditure. In our way out of the crisis, we will have built a care economy on the basis of publicly funded care services for children.